would like to thank Peggy and Melanie and Kathy for the opportunity to speak. It's kind of a unique perspective for me because I'm going to speak to you primarily from the lens of being a patient on the other side of the fence. And then at the end, my goal here today is to help you kind of see what it's like bringing that into your own practice as a therapist and sort of the things that I've learned from being a patient. I've been a physio for a long time, as you heard. But going through my own medical experience, I really sort of shifted my perspective and what it's like being on the other side of it. And primarily around hearing information and taking things in from healthcare providers, no matter who they may be, and how difficult that is, even when you are a medical person yourself. So I'm going to go in and share my slideshow here. Hopefully we'll do okay. Okay, is everybody seeing that all right? Okay, all right.
Nicole, just remember to put it on slideshow.
Thank you.
Bet.
I knew I'd be missing a step. Okay, we're doing okay then? Okay. So I knew I had cancer. I knew before anyone else did, before the doctors said anything, before I had a scan, results, I just knew something inside, and I saw it on a technician's face. Her nonverbals, her expression just told me. So this was May of 2015, and I had 2 little boys in kindergarten at the time, and I had gone for a yearly mammogram that I've been doing since the age of 30 because my mom had cancer in her 30s. So I'm going to skip ahead to the fall of that year, and I had just finished radiation treatment and kind of was in the throes of that. And it was the first day I kind of had energy and could get dressed and get out of the house, and I decided I wanted to go watch the Queen City Marathon. And so my neighbor Marge, she's in her 70s, and there's just a house between us, and she drove over and she picked me up and she pulled right into the driveway, and I could barely get from the car to the park bench where we watched that marathon. I had no energy. I was exhausted and just full on tired out, but I needed to do something normal and do something and cheer friends on that were in this race. So we're sitting there on this park bench and people are going past and I'm waving and cheering them on. And next thing you know, lo and behold, it's Saskatchewan. So everybody kind of knows everybody. And people kind of are running past and they're stopping to cheer me on, and they're kind of hugging me. And it's the first time people are seeing me once after my diagnosis. And I sat back down and I thought, bloody hell, I am running this thing next year. I am not sitting on this bench, despite where I'm at right now. So we'll skip back to May, the spring when I had this mammogram. And about a week or a few days later, I got a call from my doctor and she said, I need you to come in. And I sat down in her office and all she did was show me this report from my mammogram. And all I could do was see that word malignancy at the bottom of the page. It just jumped right off, and it's the only word that I saw in the whole report. It's the only word I heard. So I just sat there in shock and panic-filled cry, and the rain was coming down the windshield almost out of the movies. And it was kind of one of those seminal moments in your life where kind of your whole life up to that moment, and then your life after that moment. And there's kind of this inner strength that must have come over me, because I'm like, I have to do this. I have to get through this. I have these two beautiful little boys at home, and I have to do what needs to be done. So, of course, up into that time, all I knew was that cancer takes everything away. My mom was diagnosed when I was in grade 12, and she died 2 weeks before my physio grad. So it was, cancer's kind of always been a part of my life. And, my mom had a really high energy personality. Everyone, kind of gravitated to her, and she kind of could fill a room, and she had this amazing laughter. And, cancer took all of that away. And she had really high expectations of me as a kid, to do well in school, look after my little sisters, that kind of thing. And it took all of that away. So that was my experience with cancer. And I think right there in that moment was like, that's not going to be me. I'm not going to have the same outcome that she had. So there's a really kind of a funny thing that happens when you have cancer. It's just this bizarre, you're still the same person, but everybody around you is like, don't know how to react. They don't know what to say. Do we bring it up? Do we not bring it up? And it's sort of this funny, I'm like, you're not going to remind me that I have cancer. I know, it's okay. And so it kind of ends up sort of being up to that person to, you sort of have to acknowledge it. It's sort of this C word that's hanging between you all the time. And so you have to be the one acknowledging it, sort of put the other person at ease that it's okay, you can talk about it. It's just this weird dynamic that happens. Another thing that was really common was everyone saying to me, you're so strong and you're such an inspiration. And I didn't feel like that at all. I did not feel like that at all. I just felt like I don't really have a choice in the matter. I'm either in it or I'm not, and you just have to do it. And it's also not really helpful to be told that, because there's lots of really, really hard moments, really, really hard days where you're literally hanging by your fingernails. And then you have this added, it kind of feels like pressure that I have to be strong and an inspiration. Everyone thinks that I am, so I have to be that way. So it's actually, I didn't find that helpful. And then you have to go on and tell your family and friends. And it's this hard moment of, you're trying to tell everyone you're going to be fine, you're going to be okay. And they don't know what to say. And it's kind of like this onus on you to present like a calmness and a wherewithal about it, because they're freaking out and they can't see that you're freaking out. And so there's just this whole sort of support thing that you're almost giving the other people in your life. And kind of, you just don't want them, there's kind of this scared beyond words feeling, like you can't even express it because it's so all-encompassing. And the thing with cancer, it just completely takes over everything. There is not one single part of your life that's not touched. Your home life, your work life, your family, your friends, your dreams, your goals, your plans, gone. Everything's gone. You literally are living moment to moment and you don't know what's coming. So it's one of those situations where you don't know until you're in it, like most things in life. I should sort of have a caveat I should have said at the beginning of my talk today is, some of you may have had experiences in your own life with yourself or your family members. And so I don't want to speak for everyone with cancer. This is truly just my experience. Someone else would have had a very different experience. So then what happens are these endless appointments. And it literally got where I was going to the hospital almost every day, and I'd be at the hospital and I'd get a phone call while I'm there saying, oh, we have you booked this afternoon for some other thing going on. So it's literally, you can't even plan anything anyway because it's a constant sort of back and forth. And within those appointments, this overreaching thing happens where you're reading into absolutely every single nuance and tone and energy and comment of every single medical person you're in contact with, because they might know something that you don't know. They know something about my cancer. They know more than I do. They know the outcome of this. Honestly, it could be right from the receptionist right through to the oncologist. So it's a common theme I want to address today is around all those interactions, no matter how small or insignificant you think they are with your patient, every single one has so much meaning because you're on such high alert at all times. You're reading into every single thing that's coming at you. And those nonverbal type things are much more important than what you're actually saying. I can't remember most of what was told to me, even in the moment, but I sure as heck know how that person made me feel and how they interacted with me being on the other side of it. But I certainly try and use that with my own patients and try and remember that. So despite me being a medical person, I can analyze, I can research, I can do all those things. Totally goes out the window. When you're the patient, you're the patient. And that's kind of the end of it. So from there, I went on and had a biopsy done by the radiologist. And that was another definite moment of looking on the screen and I can see the lump. It's right, literally right there. There's no guessing around about it. There it is. And I had sort of this sense of kind of betrayal from my body. Like, how could you be growing this inside and I didn't know? How could this have happened? From there, I went on and had a consultation with the surgeon, and lo and behold, I have so many like threads of physio through this whole experience. It's amazing. My surgeon was in the physio class above me. So she said it so affected her to have my name go across her desk, that this was someone that she knew from way back then. So, treated me so well. And so the plan was to have what's called a lumpectomy and a sentinel node biopsy. And honest to gosh, everyone, I had the surgery, came out of surgery, and I still did not have a clear understanding of what that meant. I came out of surgery, I didn't really truly know what had happened to me. So it shows how you're so out of it. You're so like, just trying to take all this information in. So the lymph nodes, going back, the surgery came along really quickly. It was my I didn't even know it came so much faster than expected. So I'm having my last day at work and I'm literally going around telling everyone I'm having surgery and I don't know when I'll be back. I had no time to give them any kind of notice. So ended up the day before surgery, I had to go in for preparation where I went into the hospital and they injected 4 needles into my breast. And the needles were injecting radioactive dye. And over the course of that 24 hours, the dye feeds into the lymph system so that the following day when the surgeon goes in and she does this sentinel node biopsy, so the sentinel nodes are the ones that are closest to that tumor. So then they're taking those nodes out, and they're seeing, has the cancer spread? That's what they're trying to find out. So the dye feeds in, and then the surgeon can find which are those nodes that have dye in them and are closest to the tumor. So the day before surgery, I was a complete mess. I was so anxious. I was crying nonstop. I was so scared. My dad took me to the hospital. We had these injections done, and I stopped in at the physio department I had checked in, and there's a physio named Tracy. And another crazy connection is when I was in physio school, Tracy was trying to get in, and she knew my roommate. And so she said, can this gal come talk to you about physio school, and how do you get in? What do you have to do? And so we'd met like 25 years earlier, and sure as heck, I thought she'd never get in because she's so shy. And here she's just the most amazing therapist. So anyway, Tracy explained, she's telling me what I could take in, but I'm crying. She's filling me in. It's kind of a disaster. The next day comes along surgery, and I'm completely calm. I'm not crying. I'm not anything. Here we go. It's finally happening. Waiting's much harder. So I had to first in the morning go to the Pasco Hospital, have another mammogram done, and they had a guide wire inserted to where my tumor was. So there's literally a wire sticking straight out of my chest. And then I had to go from there over to the general hospital where the actual surgery was. And so what the surgeon did was one incision. I don't know if you guys can see, I'll kind of give little demos as we go. So I have one incision across, kind of just under my axilla, and she went in one direction to get the tumor out, and my lump was very, very high up on my chest wall. So breast tissue comes all the way up to your clavicle. So my lump wasn't actually even in my breast. It was way up high on my chest and tucked in underneath a rib. So I'm the poster kid for early detection because I was told many times over the lump would have never been found because it was too hidden away underneath. I actually sent a thank you card to the mammogram office to whoever had done it that day. Nicole Albright, such and such a day, thank you, you saved me, you found my lump. So she went in one direction to get the lump out, and then she went in the other direction to get these nodes out. So usually a sentinel node biopsy, they'll take 1 or 2 nodes out. The doctor took out 5 nodes. So she was really, the nurse said she'd been really extra careful making sure they got everything. Kind of when you hear those terminology. So I got discharged that night. I'm like throwing up. I'm hopped up on these pain medication. I don't even know what's really happened. Kind of a mess. The pathology report came back and I was stage 1. So stage 1 means the lump is less than 2 centimeters and the nodes were clear. So there was no cancer in the nodes. So despite them being clear, I had 5 of them removed that were completely healthy and fine. So you can see where I'm going with this as far as my lymphedema. So the nodes were clear, the lump was small, but the cancer, they also grade your cancer, and I was a stage 2. So that means it's more aggressive. The cells are more aggressive. Partly because of maybe I was younger, and also they discovered that my cancer was estrogen receptive. So it means that estrogen was feeding my cancer cells. So you're just taking, like, it's so involved, so much information kind of coming in. So by the 3rd day after surgery, day 3, I'm still on drugs, I'm still like out of it. I can kind of feel this sort of cord coming out underneath my armpit, and it's starting to make its way down my arm. And I have no idea what this is. I'm like, is this a nerve? Is this a vessel? What the heck? Next day, it's going farther. Day 5, it's already getting past my elbow, and I'm having trouble straightening my elbow. So I get into the lymphedema clinic, and I see Tracy, and she tells me I have axillary web syndrome. And the more regular name for it is cording. And it literally feels like a guitar string inside your arm. By the time I get into Tracy, it's traveled all the way down towards my thumb. I'm having trouble moving my wrist and my elbow at this point. So axillary web syndrome happens due to trauma to the lymph system. And what it is that, so we have these lymph vessels throughout our whole entire body. And so what had happened, there's the lymph fluid is inside the vessel. Well, now those nodes were taken out up top. Well, the fluid's still in the vessel and it has nowhere to go. It can't drain or go anywhere because there's nothing up top connecting it to my proximal part of my system. So what ends up happening is that vessel starts adhering and sticking down all the way down my arm, stick. And if you don't get it treated and you leave it be, the swelling starts increasing and it gets worse and worse and worse. So you have to have it treated. So Tracy, it's very gentle treatment, and she goes in and trying to release and let go this cord all the way down my arm. And literally during the treatment, we can hear it go pop, pop, pop as it's releasing down my arm. It's not painful, but you can feel, and afterwards, of course, it's feeling better. And then I have to do all my good old physio, range of motion, and exercises to keep my arm moving. So as the summer goes on, my arm's feeling pretty good. Like it gets back to where it's feeling like it normally felt, like reasonable. So within the midst of that, I'm going for treatment for this physio, but then I'm waiting for the next stage, which of course I think is radiation. So I have my first appointment at the cancer clinic, and I get there and they're saying, well, the medical oncologist is coming in to see you. And I'm like, what's the medical oncologist? Well, that's the chemo doctor. Oh, I didn't. This is the first I'm hearing of chemo. So he comes on in and he starts talking all about chemo. And I get kind of teary and whatever. And he's a sweet man and puts his little hand on my shoulder. And he's like, what's upsetting you today? Chemo? And I'm like, yes, I was not prepared for that word today. And so literally right then and there, I have to make a decision if I would go ahead with chemo or not. Like, it's just crazy that you have these like crazy life changing decisions right there. And he says, well, if you are willing to have chemo, if you need it, we'll send a test away and determine it. But if you're saying I won't have it regardless, we're not going to bother wasting money on the test. No, of course I'll do whatever I need to do, I tell him. So they send a sample of my lump to a lab in California for something called oncotype testing. And oncotype testing, it sort of looks at how aggressive those cancer cells are, how they would react to treatment, that kind of thing. And they, what it's looking at is rate of recurrence within 10 years. So if the test comes back and it's low risk, you don't need chemo. High risk, you need chemo. Then there's intermediate or moderate risk in the middle. And he's telling me, well, right now they're doing this great big randomized control trial on breast cancer survivors in that intermediate risk range, and we don't know yet. We don't have the results back yet. So I'm like, okay. So I wait 6 weeks for these results to come back. So all summer, waiting. And get my call the one day, come on in, wants to talk with you. So I am literally, it's all or none. I'm having chemo or I'm not. Like they're going to tell me. Well, sure as heck, my results are just over the line into intermediate risk. So if you can see on the bottom, the number 20, that's where, and that's literally my paper. Those arrows he drew on there for me to explain the results. And so there I am in his office trying, literally right this moment, I have to make a decision what I'm going to do. So one of the probably most difficult decisions I've ever had to make. And I'm telling you, I read his body language and I read into every phrase and way he was describing this to me, and he can't really tell me. But I'm like, what would you do? And all he kept saying, the results are inconclusive, the result of this study. And I'm just like, so to be 100% honest, I listened to my gut. I'm standing in this office and I'm like, I don't think I need this. I just don't think I do. But literally a life and death decision right there. So sure as heck, about a year and a half ago now, maybe 2 years, that study, that randomized control study came out. It was in the news on CBC. I listened to a whole radio program on it. And women falling in that intermediate risk do not require chemo. So I made the right decision, but I didn't know that I was making. So I guess the lesson is listen to your gut, do your research, do all those things, but your intuition says quite a lot. So to be honest, I hadn't told many people this. I probably told 5 people, and everyone else, I just say, no, I didn't need chemo. I just tell them because it was just sort of this really tough thing. And so I just didn't tell anyone. And, now of course I'm more open about it, but that was a huge hanging fingernail moment, let me tell you. Okay, so we get through the no chemo and then we go on to radiation. And I don't know if you know much about radiation. I thought I knew a lot about it because literally the machine that they're showing there is the same machine I helped my mom get onto, and she was going through radiation when I was in university. And so it was just like this universe doing crazy things, and here it's me doing the exact same thing. So before radiation started, I had to go in and have a CT scan done, and they tattoo these little tiny dots on you. So I have 8 dots on permanent tattoos on my torso, and they use those tattoos to line up that radiation machine the same way every time so that you're always lined up exactly the same. And those dots, they bothered me for a really long time because I saw them, they represented fear, they represented all this stuff that I had gone through. And I had a friend one time say, you know what if you framed it differently and thought of them as your constellation? And so I thought, okay, so I checked out constellations and researched that a bit. And so then the Phoenix was the constellation that really resonated with me. So I think of that now. My Phoenix rising from the ashes is those dots. So I went on to have 21 doses of radiation, and it went over for 5 weeks in time. And oftentimes a normal, more typical dosage is 25. And I thought, less must be better. Well, no, less is more. So as I got into it, I find out that actually my dosages were kind of like this. So every day I'd get a higher one, and the next day a lower one, and then a higher one, and then a lower one. So my dosage was actually higher overall than the longer duration. The thing with radiation, the effects are cumulative. So every treatment compounds on the one before, and they just keep building on each other and building on each other. And actually, when you're finished radiation, the 2 weeks after are the worst because it just keeps compounding for 2 weeks after. So you're all finished your treatments and the effects actually keep going. So it was just this crazy, surreal experience of going every day, and you'd lay on this big hard slab, and you'd have to have your hands up over your head to hold on. You're topless to the waist, and the techs are in there and they're shifting you like it felt like a little centimeter at a time, and they'd look at each other and say, are you happy? Yeah, I'm happy. And I'd be laying there going, I'm not happy. And some days I'd be totally fine. I'd just be okay. Other days I would be a little bit tearful, and then other days I'm just sobbing and the tears are rolling into my ears, thinking of my mom. The room's all black. Not black, the room's darkened. There's signs everywhere, just exactly like the one on the screen. Radiation in progress, danger, danger, danger. And you're laying there thinking, oh my God, they're beaming this into the chest. And, you know, the techs all go to the safety of a room and you're sort of just left laying there. And it's really surreal. Oftentimes they'd have music playing. There'd be like Fleetwood Mac or like country music. And you're like laying there going, is this for real? It's crazy. And you have to just kind of pretend like it's a normal thing. It's just the craziest thing. So when they're radiating, all these things I learned, I didn't know. You think you know this stuff, but you don't. So they radiate this whole entire upper quadrant gets done. It's not just the spot where the tumor is. So all this whole side got radiated. And super specific. They were so that big machine kind of rotates, you know, side to side, and it beams it from one angle, and that, you know, every possible angle they can get you at. And literally, the tech said they miss your heart by 2 millimeters. So you can't breathe, you can't move a muscle, you're just laying there holding your breath. Some people get through radiation relatively unscathed, I guess, get a little bit pink. Some people, oh yeah, I worked, I did everything right through it. That was not me at all. By the second day, my skin was pink. By the end of the first week, it was fire engine red. So I'd literally leave the treatment, go straight to the bathroom at the cancer clinic, slather with this lotion they tell you to stay on, you know. And then about partway through, I ended up the one day I'm like, I had this little tiny blister at the end of my incision. And I thought, oh boy. Well, guess what? It grew and it grew and it grew. So it got to the point, I still had the last 5 treatments they called boosters, where they increased the dosage higher yet. And I still had the boosters to go, and my skin was breaking down so badly. The oncologist gave me the option to quit. And in retrospect, maybe I should have, but at the time I'm like, nope, that's what you prescribed. I will carry on with it. And so it got to the point in the once I got into those boosters, they were like the size of my palm, this big open area, and it was just gaping and oozing and red. And then the whole part under my breast, like from my chest out to my rib cage, was the same, just like red and raw. And so then I would have to dress them with dressing to get to the hospital to have my treatment. And then I would come home and I literally just had a robe hanging off my shoulders, out open to air, polysporin, and these saltwater compresses to try and not let it get infected. And then when I finished the treatments, they worsened for 2 weeks after that. So literally, I just was pretty much in bed, walking around the house in bed. My little guys, they got to the point where they're just like, Mom, are you ever going to wear a shirt again? It was just like, so like, they're like, whatever, it's just the things that become normal, right? So just warning, here's a photo of before the boosters, what my breast looked like and under my arm. So this was before the skin really opened up and it really got nasty. This was about halfway through. I should have maybe had photos later on, but you're not really in the mindset. So if you think radiation is actually burning, it's burning tissue. So whatever it's looking like on the outside, it's doing all of that right through. So your skin, your muscle, your fascia, your bone, your blood cells, your nervous cell, your nerves, literally ligaments, tendons, everything it touches is affected. So it changes the DNA of those cells for life. They're never the same after. And it's sort of like this low-grade inflammation in those cells at all times. So going forward, once we get talking about the lymphedema part, is finding this balance, because you don't want to increase that inflammation, which increases fluid, which increases your lymph load. Like everything's just, it's this fine, beautiful, fine balance that takes such a long time to settle. So with those radiation and the radiation burns, any kind of fluid movement and stuff I had after surgery that we worked all summer on, gone. Now I have major radiation fibrosis, it's called, and the cording is back with a vengeance. Everything is stuck. So now what's happening is I have a cord running the whole length of my arm, literally to the tip of my thumb. My whole entire breast, the whole lymph system, it looked like a web. You could see all those lymph vessels on my breast and all the way down to my hip. So literally the whole entire lymph system on my left side of my upper body was inflamed and stuck down. And then everything starts getting the drainage. It's a blockage, is basically. My lymph system is more blockage than drainage issues. There's sort of, it could be one of the two. So I get back into Tracy, and the one day I'm like, my arm is really starting to feel heavy. And her eyes are like, okay, it's heavy and it's achy. And she says, you have lymphedema, and we need to fit you with a sleeve. And it's another one of those first days. So up until then, I've been going to that lymphedema clinic for the cording, but I didn't have actual lymphedema. So I'd see all these other women with sleeves on and the lymph pump and all this stuff, and it would kind of freak me out. But I think, well, that's not going to be me. That's not going to happen to me. Well, then it is me. And all along, all the surgeons, all the doctors I saw were you don't need a physio referral. It's just radiation. It's just a lumpectomy. Well, no, it's not just. So it's a real learning curve for everyone. We're in the medical profession. We're all so like focused in on our little thing that we know. So the radiation oncologist, he only knows about radiation. He doesn't know all those effects that happen from it or after it. The surgeon just knows that she went in and she got it out and you're good. Well, no, all the trauma from that surgery. And going back to that part with the surgery, a lumpectomy in my mind is like you go in, you pluck a lump out, you're done. No, you're cutting through muscle and fascia and tendon. I have a nerve that was snipped and I'm still numb from my armpit to my elbow to this day. It's still numb there because of this nerve. So there's way more trauma. There's so much more involved than people realize. So then I end up going to physio 4 times a week. We have to get this under control to get the fluid flow, get motion, get movement between the tissues before this becomes irreversible. This is like heavy duty stuff. So here's what I know now. You could have 30 lymph nodes under your armpit. I might only have 10. So not everybody's the same. Not every lymph node or lymph vessel is as important as the others. So you may have something removed that's a back alley, or you may have something removed that's Main Street. I think I had the Trans-Canada removed because it's had such a far-reaching impact. Lymphedema affects approximately, I've seen everything from like 15 to 30, but approximately 20% of breast cancer survivors end up with lymphedema. And it can happen right away, which is sort of my experience, or it can happen years later. So it doesn't mean you're out of the woods because you didn't have it right away. They really, truly don't know. So I've heard everything from it could be genetically involved. There's like some people can have, I have heard of women have all kinds of nodes removed and don't get it. I had 5 removed and I got it. So we're not really sure. Fluid can increase in my arm by 30% before it visually looks swollen. So that's why it feels heavy and achy. So I'm the first one to know that I'm heading into a flare-up because I can feel it, even though you can't actually see it. It doesn't look any different. So that fluid goes into all the interstitium. It's all, you can't just go in and drain it because it's all between every cell and it's kind of everywhere. So you can't just go in and drain it out. It doesn't work that way. So lymphedema is an accumulation of a protein-rich fluid in the soft tissues, and it results in an interruption of a lymphatic flow, and it causes swelling of that affected limb. I actually have, my breast is more of an issue than my arm. Never have heard of breast lymphedema before. It's a real thing. No doctor knows about it. Oftentimes women will be going to they keep having all this swelling and achiness and kind of infections in their breast, and they get diagnosed with mastitis and all these other different things, and that's not it. It's lymphedema. So my breast is as much of an issue as my arm is. Your lymph system is the workhorse of your body, and it transfers essential sort of immune chemicals throughout the body, and it helps rid your body of like cancer cells and infections. And so when you have a cold or you have the flu or you cut yourself and you get an infection in a finger, that's your lymphatic system. It's working hard to rid your body of those things. And it pulls them and takes them into your cardiovascular system, and you end up peeing it out. That's how we get rid of our lymph fluid. And there's a thing called lymph load. So in a normal lymph system, my max lymph load is sitting here, and I've all this, I usually hang out about here, and then I get a cold and my lymph system's getting up here, and then I'm maybe fighting off some type of an infection. Somebody has a bladder infection or something, and then their lymph system, it's busy, it's thicker and there's more happening, but there's still space and room. Lymphedema is you're above that. And so in these early days of lymphedema, I was riding the line always here, trying to get back under, but riding the line. And then I ended up coming over. And as the stages progress, you get above, and then you can't get back under, and you can't get it under control. So hopefully that's kind of a good explanation. Lymphedema is extremely resistant to treatment. It causes chronic inflammations, infections. You end up with hardening of the skin, and it can cause distortion of the limb. It can cause full body sepsis and death. So it's not to be taken lightly. And even when people, to look at me from the outside, I look totally normal and fine. It's a constant management. It never goes away. There's not a day that you can't. It's less now. I'm more stable than I've ever been. But literally every activity I do, I have to consider that lymphedema. Traveling, sports, hot weather, that kind of stuff we'll talk about too. So here's a picture of stages of lymphedema, and depending on what you're watching, some of the, what's the right word I'm thinking, classification systems, some are stage 0 to 4 and some 0 to 3. This particular one is using stage 1 to 4. So same thing, just a different number applied. So if you look in stage 1, it looks pretty, you're not like, a quick glance, you don't really see a difference. But if you look closer, particularly at her hand and her wrist, she's got sort of more wrinkles and skin fold and knuckle. You can kind of see better on her right arm than her left. It's just a little bit thicker through her wrist than she is. Stage 2, there's a definite difference if you look all the way down the length of the arm. And that's how they measure for compression, is they do circumferential measurements around your arm to determine the right size. So stage 2 is pitting edema, but it is still reversible. Stage 3 is edema, but it's no longer reversible. So this woman in stage 3, her load is up above here. She can't get it back down and under. And then stage 4 is actually what they call elephantitis. So you truly have changes in that limb. And if you look online, like there are some, I was going to include a couple, but lower extremity lymphedema, there are some crazy photos of people like their limb is completely distorted, and it is something to behold. So those are folks, it's something to see. So some really good sources are the sasklymph.ca and the canadalymph.ca. And Canada is actually really up there, and locally here, gosh, we're so lucky. We have coverage for compression garments and stuff that nowhere else in North America has. So I'm extremely lucky to live in Saskatchewan. The treatment is extremely complex. I could talk to you all week about the things that were tried. I literally was in active treatment for 3 years and going several times a week at times. Things would kind of settle down, and then I'd go back into a major flare-up, and the flare-ups can last sort of 3 to 6 months, and then it's full-on heavy-duty treatment again to get things settled down. And when I feel those coming on, it's very anxiety provoking and very, very concerning, because you always have in the back of that mind of becoming that next stage and not getting back to where I am. So here are some of the things that were used for treatment. So kind of everyone thinks, oh, that sleeve, that's all you need. Well, the sleeve is just one part of it. These are my daytime compression garments. And the daytime garments, they don't reduce your swelling, they just maintain it. So they go on in the morning when you're the smallest in size, and the idea is it's going to hold you and you won't swell up during the day. So my vest, everything's all custom made to measure. My vests are made down in South Carolina. And the gauntlet for the hand, the first several years I wore that most of the time too. And especially when that cording would be into my thumb would just swell up like a sausage. So I was needing to wear, and some women need the full glove. They have the cut off fingers. I typically had the thumb and partial of the fingers. So I wear that as I need it, but now I'm pretty good. I usually don't need to wear the hand. So this is what I literally wear every day. Wearing it now. Got my compression vest underneath, and I wore a fancy nice sleeve for you guys today with my roses on it. So they last about 3 to 4 to 5 months, and then I get new ones. I always have 2 to 4 sleeves on the go at a time. Got to wash them out every night. Care for them. Yes, they're hot. Yes, they don't breathe, and they totally suck in the summertime. I do have some compression bras that I wear that maybe on the weekend, but this is my go-to. This is what 90% of the time I have on at all times. Then my nighttime garments. And so we were finding daytime compression wasn't enough. I needed nighttime also. So the black things are for my breasts. They're kind of like a tube top thing that goes around. And pardon me, you'll notice that there's kind of sewn grooves in them, and they help reduce swelling during the night. And then the bottom piece goes over top, and that's the compression to make it extra tight. They're also made in the States, and then my arm sleeve is made in Germany. And I actually have a brand new one. It's getting fixed up right now, some alterations, but it's bright purple, but it has grooves actually that are more lines that go up and mimic the lymph vessels. The night compressions do help drain, because there's 70% of our lymph system sits just underneath the skin. So at night, as you're shifting and moving and whatever, you see the little divots in the the arm garment. They kind of move my skin all night long as you're moving and shifting a little bit, and it helps move that lymph fluid up and across. So this is bedtime. Of course, just wear it under a nightie usually, and then the picture on the right is my skin. So that's what my arm looks like in the morning after I take the sleeve off. And so it sort of looks like golf divots on my skin, but to be honest, that's the best my arm will feel all day in the morning. Pardon me. Because it's the smallest that it is all day. It feels the best, and then I just put my sleeve on after. So much talking now, I'm losing my voice. So for about 2 years, I needed all of that compression. So the only time I was not compressed was in the shower. I literally had to be compressed at all times. Now I'm a lot more stable, and I just wear my daytime compression and my nighttime as needed. So if, let's say, I'm traveling or I do too much yard work, or, I'm feeling more achy, more heavy, actually sitting in computer work is probably the worst thing for it, because when I'm using my arm and strengthening, and then that's your pump, that's your muscle pump to get the fluid moving. So manual lymphatic drainage, this is what was taught that I can do myself. So they'll do this at treatment as well, but I can do it myself. So working through the lymph system of my neck, my chest and breast area, and then my arm. So I will do all of that. And the whole thought and idea is to try and move the fluid from my lymphatic side, that's damaged side, across to my healthy side. So you have all these nice lymph nodes in here that are, it's trying to get it into that side of my body. I also was kinesiotaped for about 6 months the summer after. And the thought and idea behind this, so the thicker blue tape on the right side, that's going up the cord. So that's the way the cord would stick down on my arm. And the thought is that the tape helps kind of pull and keep it away from adhering. And then the other fingers coming across this way go in line with the lymphatic system, and how the tape works. It's pulling the fluid up my arm, and I don't have another photo, but I actually had all of that. Then the fingers would come across my breast and my chest. So a whole, probably 6 of them would come across, and they would anchor over to my healthy lymph nodes. And so that pulls that fluid up and across to my healthy side. So I literally was like that for 6 months. So every 2 days, 3 days, I'd have to retape. And then I would have that underneath my compression garment. So I taught my family, my sisters, how to do it and all this kind of stuff. And then that is the lymph pump. So how this works, it's kind of the same. It all has the same idea behind it. So when I am in a flare-up and I can't get things down myself, I would come in and they'd book me in for some pumps in a few times a week also, on top of regular physio. And it's like this big, puffy, sort of Michelin vest jacket. And the only thing that's not in it is my right arm. And it sequentially pumps up the arm, up, and then it pumps my back and my front, pump, bringing it to my healthy side. So it's just pumping up and across, up and across. And so you're on that for about an hour, and then you are literally racing to the bathroom because you got to pee all that fluid out because it's pumped into your system to get it out of you. So some of the other things, so obviously gentle mobilization of tissues and those lymph vessels to get them to be unstuck, and then heavy duty major tissue work by the therapist that I certainly cannot do myself. I feel like I'm run over by a truck after, but it's a hurt so good feeling because the tissues get so stuck down, and I literally can feel them, like even now, they get so stuck to my rib cage that you can't stretch them. There's no elasticity. All that's gone after radiation. So the therapist gets in there, gets through all these tissues, and literally during a session, I'll be laying there on the plinth and we'll see my breast just go whoop, down in size. It's just fascinating. Like you just see it happening. So maintenance is really important. I also attended specific pool therapy classes for lymphedema, and there's a full-on program. There's about 48 stages or steps that you go through, and it's different motions in the water, and it all has to do with compression of the water at different angles and different degrees. And particularly if I'm away on a hot holiday or anything like that, hot or getting in the water is the best thing because it's compression on my tissues. It helps get, so those pool sessions, same thing. Like women, you're constantly going to the bathroom during the sessions because it's getting that water, that fluid out of you. I had a very specific home strength and stretching program, and I was a very good patient. And I would do that 45 minutes twice a day. And I did that thing for like 2 years. So it's a full-on commitment. Deep breathing, relaxation techniques, that kind of thing. But deep breathing is really important physiologically because the main lymph vessel travels down the center of your body and it pierces through your diaphragm. So by doing deep breathing exercises, it pumps that lymph vessel and it helps to clear the fluid as well. So it's not just a relaxation thing, but it physiologically helps your lymph system as well. Reducing stress. Stress is a big factor in a flare-up as well, and then it's just a compounding thing. You feel a flare-up coming on, you get stressed out, it makes it, it's just like most things that we have. And then another big one is preventing any injury to my arm. So now I have to be very mindful. It's a constant in the back of my mind. So I have to keep my skin on this side of my body clean, moisturized, no hangnails, no nicks from shaving or, preparing food. I have to wear gloves if I'm doing yard work, or I don't want to get a pet scratch on it. I have this pink band alert. If I am ever admitted to hospital for any reason, I would wear that on my arm. So I can't have any kind of injections or blood work or, if I go to get a blood test taken or something, no injury to that arm. There's a lady that I know that she ended up with full-on stage 3 lymphedema from a hangnail. So it's like people are like, why are you freaking out? And it's like, well, it's a bigger deal and people don't realize. So I always carry alcohol swabs and Band-Aids and antibiotic ointment in my purse if ever I have any kind of issues around that. Heat is the worst thing for lymphedema. So besides, in the summer, you're wearing all this compression, you're hot and sweating. It's like this double-edged sword, but so hot tubs or saunas or hot weather, sunburn, all that. I have to avoid all of that stuff. Avoiding weight gain. Extra weight and obesity are a major detriment or even sometimes can lead to lymphedema. So that's a big one. As well, estrogen not only stores but is produced by fat cells. And estrogen fed my cancer, so trying to keep weight off for that reason as well. And then if ever I'm flying in an airplane, sometimes because compression and whatnot in the airplane makes limbs swell, people get swollen ankles in the airplane. So that's a huge thing. Sometimes I'll wear actually my night sleeve on the plane because it's thicker and heavier and it's helping to drain or I might have to tensor bandage over top of a regular sleeve just to make sure my arm's not swelling. So yeah, cascade of events is a flare-up and I get panicky and it's horrible. You're like, oh my God, is this the time it doesn't get better, that it doesn't get back to being okay? So it's just a constant reminder. I don't want to get to stage 2 or 3 where it's those chronic infections and sort of that irreversible swelling. So basically just constant interventions. I haven't even told you. there are many more yet, but that kind of gives you a basic rundown of it. So just something to really consider is that I have this chronic condition, this lifelong thing, and it's not due to cancer, it's due to the treatment of cancer. And it's just this constant reminder of how destructive cancer is because of how hard they hit you. So I had this little tiny, less than a centimeter lump. That was it. It wasn't in my lymph nodes, it was nowhere else, and they hit me with a tsunami. So it just makes you realize how, obviously, how destructive it can be. A couple of years ago, I went to a lymphedema symposium that was here in Regina, and Tracy brought in like the top dogs from Stanford. There was a surgeon from California, and then the top head lymphedema doctor, I think he's at Harvard, I'm not sure. Anyway, and so they were presenting latest research, latest sort of things that were coming out. And so the one surgeon, he specializes in lymph node transplants. And so what he does is they'll go in and they'll transplant maybe from like your groin, take the lymph nodes out of there and transplant into your affected area. And actually they're having really quite good success with that. Then the fellow from sorry, I can't think of I can see his face, can't think of his name. But he's talked of a thing called biobridging. Basically what that is, it's bridging the gap from that cutoff where the lymph vessels cut off and then it's not connected to the rest of your lymph system anymore. So some type of a bridge that would bridge that gap so the fluid could flow through. It's literally like coolest stuff. And then the last thing they talked about, which would be amazing, is some type of an anti-inflammatory pill. So who knows, maybe in my lifetime there might be something out there that would be helpful. So another thing that held over me, hope you guys are hanging in with me, we're getting to it, was genetic testing. So this is often in the news, like Angelina Jolie and all that, people getting genetic testing. And so I decided to go ahead and have it done, and I could speak about this all afternoon. It was a far-reaching thing because it has implications for your entire family. And some family members maybe don't want to know if they have a genetic mutation, and some people do. Because my mom had cancer at such a young age, I wanted to find out for myself if there was a genetic component, and also you can pass it on to your sons. It doesn't necessarily have to be only daughters. So I could be passing this genetic mutation onto my sons, and then it would show up as different cancers. And also, if you do have that genetic mutation, it's not if, it's more likely when your cancer. You have like an 80 to 90% chance of breast cancer coming back and over 50% chance of ovarian cancer. So there's very strong linkage there. So I was on a wait list for 2 years, hanging on, waiting to find out about this. And so when the time came up, they sent me this booklet, and I had to fill out every kind of detail about every single relative that had cancer. Not only diagnosis, but where they were diagnosed, when, what happened. Like it just went on and on and on. I had 28 people to research on. And so it was it's through the genetic clinic in Saskatoon, and we did it through telehealth, and the gal was very like, this is looking really likely for you. But so I went ahead and had it done, and I actually had 21 gene markers tested, and they tested for ovarian, colon, and breast cancer. And I get a call at work one day, of all places, and do you want to hear your news? And I'm like, okay. And all my markers were negative. I had no markers. So I totally lost it at work. I'm telling everyone, besides they knew before my family. So I had no genetic markers for any of that. So that was a huge thing. It took me a long time to just sort of let that go because I've been carrying that for a while. Next thing was the run for the cure. So this was so I finished that radiation up in sort of August, September. And then in October was Run for the Cure for breast cancer research fundraising. And I'd said to my sister, Carmel, on the left in the summer, I really want to do this. And no matter where I'm at, I don't know where I'm going to be at, but I'd really like to do this. And would you do it with me? And I was like totally low key, just her and I were going to do it. Like, I don't want any fanfare, no nothing. Well, then my youngest sister gets on the ball, and she's the one in the middle. She lives in Edmonton. And she's like, well, I think we should have a team. And I'll organize it. She's the little organizer. And she says, I hadn't been public. I had been open about my diagnosis, but I hadn't been super public about it. And I said, I don't know about that. She goes, no, I think we could really make a difference. So that's my stepsister on the far side. So all my sisters. So lo and behold, we had over 80 people and we raised over $10,000. It was crazy. It was just like, so humbling. It was unbelievable. So we had people, kind of had a team in Winnipeg and Edmonton. This is, of course, the Regina crew. So friends and family and coworkers, and so it was amazing. And I did a big speech at lunch after, and I was a total mess. But anyway, it's something. But just going through a few. Of course, there's my little guys at the bottom. And these are thank you cards that the kids made for everybody. So, oh man, didn't think I'd cry as much as I am today. You guys are being patient with me. Anyway, so, despite all this stuff going on, how I'd said, yeah, I'm going to run in that race. And, a year later, well, I tend to be a little on the stubborn side, and I did it. So this was a year later. Oh, I'm skipping ahead. I'll jump around. So there was the Queen City Half Marathon that I did. And yeah, it was awesome. I could care less how fast I went, and I high-fived every grandpa and every little kid, and it was just amazing. So I'll just jump back. Melanie warned me that she jumps around a little bit too with everybody, so it's okay. So this was another thing that, that the corny stuff about all these amazing things come out of tough times, but really lots of amazing things have come out of it. So this was about 8 weeks after done radiation, not these photos, but this situation. Tracy asked me to come with her to present to Healthline 811. They were going to try this pilot project for lymphedema. And the idea was that any woman in southern Saskatchewan that had their breast cancer surgery at the general hospital would get a follow-up phone call. And basically it was a screening for lymphedema and any sort of post-traumatic stuff too, but primarily around lymphedema. So anyway, Tracy's going there to do the whole, the talk on lymphedema, and she goes, you're going to come be my human story. You're going to be my patient. And so, of course, I did it in about a 10-minute blurb, a quicker thing, but there were representatives from the Ministry of Health, the Sask Cancer Agency, the Healthline 811, the whole works was at this table. And you could have heard a pin drop when I spoke. And I think the thing was that I looked just like them. I'm a healthcare worker. I'm around the same age. It was all women at the table. And I got myself put together and went to this thing. And I think they all sat there thinking, holy cow, that could be me sitting there. And then afterwards, they asked a lot of questions, and they're like, what would be helpful? What would have worked for you? What would you see in this program? So I just honestly said what I thought. And in the after effects, they said the biggest thing that struck them was that I'm a healthcare professional. I know how to look this stuff up. I know how to research in that, but you're so overwhelmed at the time. You just can't do that. You need outside support. And so what does, somebody living in rural Saskatchewan that does not have any background or supports locally, so they wanted to roll out this program. So lo and behold, this is the following May, I get invited back to speak at this media release, and that's the Health Minister, Dustin Duncan, talking to me. And it was like a full on the other side of this podium is like full on out of the movies cameras and reporters and the whole thing. And afterwards we had to do a scrum and the whole deal. And so it was just this really amazing experience. And now, this little thing of just telling my story, and now that's what the program's out, and every woman gets this phone call. And the lady on the far left, she explained at the release that they completely expanded and changed the program according to what I advised, what I suggested. So it was amazing. So they were trying at the time, they're going to try and expand it to northern, like Saskatoon as well. I'm not sure what's come out of that, but so that was a cool thing. This is another experience. So these are, the gal on the far right is Tracy, my physio, our physio, and the rest of the ladies are breast cancer survivors. And the lady in the middle, Sangeeta, we met through voice first. We were always on either side of the curtain in physio treatment. And we would like compare stories without actually having seen each other because we end up being there at the same time all the time. So anyway, we got to be really good friends and came up with this crazy idea one night. She has quite a high-end healthcare job, but on the side she teaches Bollywood dancing. So like her dancers are amazing. They perform at Mosaic and stuff like that. And she's like, we should dance at the High Tea of Hope. So we thought there'd be 30 women, and it ends up being the 5 of us. So we've done it twice now, and it is just the most amazing experience. We do this amazing dance. Sangeeta has choreographed the whole thing, and it tells the story of a woman's experience from diagnosis through healing and treatment, and then in the end, it's this major celebration of life, being surrounded by her women. Our saris are handmade for us in India. Those are ours. They belong to us. She measured us up, and they're gorgeous, and we just feel like the most amazing women when we're doing this dancing. And we just have this connection that is just, none of us knew each other before, and now we're just glue. Because nobody knows what it's like until you're in it, right? So this was actually just last October, this last time that we did it. And so here's just a few photos. So here's Sangeeta hearing the news of her diagnosis, of course, as she's celebrating later on. And so it's just awesome. It's a lot of fun. So we're probably dancing in front of 350 people. It's just something we never would do, but now we think we should take our show on the road. So who knows, never know. So the thing I was asked many times, I get asked about, what did you learn from your experience? What could you tell me that would be helpful? I'll have people, my sister-in-law just got diagnosed. What would help if with her? And so there's certain things that people say to you that aren't always helpful. And it's meant in a place coming from kindness and love and caring. But when you're on the other side of it, it's really actually quite difficult. So I'll just kind of run through some of these. And the first one is when people say, what can I do to help? Let me know how I can help. And when you're on the receiving end of that, it's, for one, you don't know what you need. You have no idea, because there's where do I even start? And the other thing is, it's really hard to ask for help. Nobody wants to ask for that. It's one of the hardest things to do. So instead, just help. Don't ask. Just pick up some groceries, take their kids on a play date, throw in a load of laundry, drop something off at the door. Like, you don't have to make a big to-do. Those little tiny acts of kindness go a really long way. And then I got told many times, you're so lucky you only had radiation, or you're lucky you didn't have to have a mastectomy, and all those kinds of things. And for one, there's nothing that luck has to do with it. And for two, yes, there's many women that have had a much more complicated course than I did and went through way more than I did. But on the other hand, it kind of negates what I did go through, and it minimizes it. And people don't realize, that all this stuff had happened. And so it's just always being sort of cognizant, or realizing there's a lot, usually more to that story than the person's probably presenting to the world. And then another thing I got asked, almost because I'm going to the hospital all the time, and I would run into people I would know, oh, are you back at work yet? So I know that's coming from a place, people hope you're on the mend and you're ready, you're doing well and you're back at work. But when you're getting asked that, it feels like you need to justify why you're not at work yet. And you have to kind of prove why you're not at work yet. And so, yeah, I looked fine on the outside, but the inside of me was a total mess. And so, and plus that radiation fatigue fog was like I have twin boys. Like, I know what tired is all about, but it's a total different thing. Like, you cannot get enough rest, and you're not sleeping well. And it's just, so, it's just all these questions are meant from such a place of love and caring, but they're hard to answer. And you feel like you have to explain yourself in a way. So instead, I like to go for simple, and I would advise, just say, how's treatment going? Just listen. You don't have to be, how I've been thinking a lot about you. How are you doing? Leave it at that. You don't have to get into too depths of it. Another part of the experience is how lonely it was. And it's funny to say that, because everyone's, rallying around you, and your friends and family, there's no way you could get through it without them, and, their love and their support and their day-to-day helping and just being there for you through the whole thing. But despite that, it's extremely lonely, because no one can do it for you. No one can do it with you. You have to do it on your own, and you have to go through it on your own. You can't go around it. You can't decide, I'm going to take tomorrow off. I don't really feel like doing this tomorrow. You got to do it. It's up to you. And so it's just a real, there's quite a bit of research behind PTSD and cancer treatment, and particularly breast cancer. So that's another whole topic. But there's definitely this sense of new normal. And at the end of it all, everyone around me was like, woohoo, and like, that's amazing. And I got discharged from the cancer clinic, and they're just like celebrating. I didn't feel like that at all. For one, it's like, why in the hell did I have to go there in the first place? And now nothing is normal. Nothing, your lens on your whole life is different, because you're so different. Nothing can be the same. So there's just so many things after and I've heard lots of women say that they felt very much that way afterwards. So there's a big component of depression in that, and a lot of those PTSD things. I didn't necessarily feel all of that, but I definitely felt a significant sense of loss, and just, where do I go from here? How do I get my life back? And what is my life like now? Because I've got all these things that I have to manage that I didn't have before. So I kind of look at sort of a list of what works for me, and how do I get past sort of that fear of it coming back. That's your number one fear. And so I have my regular checkups for life. Every spring I have a mammogram. Every fall I have an MRI. Sometimes it's easier than others. You think you'd be fine. Sometimes it's really anxiety provoking, and it's really scary. The MRIs are usually at nighttime, and a breast MRI is actually face down. So it's a different kind of experience. I was on tamoxifen for 5 years and I just got off it this summer. So I'm literally have no cancer stuff treatment wise anymore. So the tamoxifen, it binds to any potential cancer cells. It's the same shape as estrogen. So it binds to those cells so that estrogen can't get in there and make things spread. So it's kind of like an extra sort of insurance policy. Nutrition is a big thing. So eating healthy, eating organic as best I can. There's certain foods that I avoid now because of the estrogen component. So actually raspberries and flax and soy, some of those things I avoid. They're not good for me estrogen wise. Exercise is like number one. Exercise can reduce your risk by 40 to 50%. So it's like, why wouldn't you do that? That's like my number one preventer. It has gives me some sense of control, I guess, although we don't have control of anything. Restricting or reducing my amount of toxins, so parabens and all those kinds of things in shampoos and soaps and lotions. I really try and reduce that as much as I can. And I try and do like a meditation practice in the mornings when I first get up. It doesn't happen every day, but I'm very regular with it. Counseling, doing the work. There's a reason that cancer came in the first place, and I believe it's a lot more than physical. So doing the work to explore that. And just really expressing my love and gratitude more openly and trying to be a better listener and a parent and those kinds of things. So those are my weights down in my basement and some of my different things I use for maintenance. And then just carrying on these, got the kids running and doing some different things as well to kind of be an example for them, but also, that's our family practice. So here's outside of the Pasco Hospital in Regina. They have the Cancer Survivor Garden, and I've been there, that Pasco, hundreds, if not thousands of times, it feels like now. And it's amazing what your kids get used to. Like some days they've had to come to appointments with me because, especially when they were much younger, and they just know. One comment I was going to say earlier was that first time at that cancer clinic, and ever since after, it's so weird when it's you in there. And I remember sitting there looking around going, I don't belong here, and I'm not like these people. Like, they have cancer. And then you're kind of sitting there going, oh, I guess I do belong here, and I am like these people. So it's just like there's a lot of bring you to your knees humbling moments that you just have to take away and sometimes find the funniness in them too. And my kids have been really, so many comments too over when we're doing that run for the cure, and they came home from school, and it was right during the time of Terry Fox run, and I never used the word cancer with them. I just never did, because I'm like, they don't even know what that word is. And so I let them know we're going to do this big run thing on the weekend with everybody, and I said it's for breast cancer, and I think it was Thomas said, you have that, Mom, don't you? And so we talked about it, and they understood. The teacher did this amazing job. And then Graham said, I said, kind of like Terry Fox, we're going to raise money for cancer. And Graham's like, are we going to run across Canada? Like, no, we're going to walk around Wascana Lake. And then another comment about a couple of years ago, Graham said to me, Mom, do you still have cancer? And I said, no, I don't. I don't have it anymore. And he said, are you still always going to have to wear your sleeve? And I said, yeah, I'm always going to have to wear my sleeve. And he says, well, could you climb a mountain? And I'm like, yeah, I'm sure I could climb a mountain. I don't know. You're all good then. Like, it's just like, you're fine. Okay, I guess I'm fine. So it's like, kids are great. They just like bring you right back to reality. So what lies ahead? So all of that preamble is basically bringing me to this, and it's how can I use my experience as a patient to have greatest impact as a therapist? And that's basically what I'm doing here today. Is I'm trying to give you a sense of what it's like to be a patient, and then how that unique perspective can influence those therapists coming after me, and how you will practice as you go on in your career. And I think the number one thing, and I tell every student I had, is that it doesn't, maybe I shouldn't be saying this stuff, but anyways, I think it doesn't really, the physio stuff does not really matter. We can all learn that. That is all learnable. It's how you relate to people. It's how you communicate. It's how you present yourself. That is going to have the greatest impact on your patient, because then they're going to buy into all that other physio stuff that you're going to get them to do. So, if we don't have those skills and we don't take that as important, and in this time when you're a student, it's like figuring out all that physio stuff. But as you go forward, we just be mindful of that. Because as a patient, your nervous system is on high alert. As I said earlier in the presentation, you're just reading into every nuance, all the energy, the tone, the way things are said, the eye, the look of the eyes, all the kind of the body language of that practitioner. That's what your patient is really tuning into. And oftentimes you try not to use your physio jargon and keep things simple and keep things concise, but you're going to have to repeat many times over, because they're overwhelmed. It's too much coming at them. And sometimes we think, geez, they don't get it. Well, they don't get it because it's too much. They're trying to cope. And I think the other point of my presentation today is that, I present to physio with this stuff, these symptoms, but there's all this stuff behind that I'm dealing with in my life on top of this physical presentation. So, and every single patient is like that. They have all these things that led them up to be sitting there in front of you. And so trying to look past the physical and look at what else is happening there for that patient, and you'll get much farther with them. I'm going to just kind of comment on just literally the basics of how we dress, and that very first impression. That speaks volumes, and it takes a lot to change a first impression. So how you talk with your patient, how you listen, how you make eye contact right from that first minute that you either walk in the door or greet them in your treatment area, it makes all the world to them. So I'm old school. I never wear jeans at work. I never do the casual Friday. I just feel like I'm so proud of what I do. I'm so proud of being a therapist, and I want to embody that to the person I'm working with. And also, it's sort of a sign of respect. If I am meeting the parents of a 20-year-old quadriplegic on a Friday afternoon, I don't want to be in jeans and a hoodie. If I'm meeting, my 86-year-old stroke lady, and I'm meeting her husband, and I'm trying to talk about all these awful, devastating deficits from her stroke, I want to present myself in a certain way. So they're going to respect that and hear what I'm saying. So eye contact, listening, giving kind of a calm presence of, I'm here to help you. And I often I think back to when I first started working, when you're like, every assessment, you're scared over to the mind because you don't know what you're doing. But over time, I'm used to working in this big treatment area that's very busy, and there's lots of kind of crazy things that patients will see. They see somebody walking with an amputation and somebody with a halo on their head, and it's stuff it's intense, it's big, it's not a sprained ankle kind of a thing. And so, I'll approach them. I'm coming across that room, and they're sitting there in that wheelchair, and they're scared spitless. Their family's scared spitless. What's this place about? What's going to happen to me here? And by the end of that session, I've gotten down to their level. I've listened. I've heard their story. I may have done as much of that assessment as I can, but the main purpose of that first meeting is for them to feel safe and to leave there feeling like I'm in good hands. They know what they're doing. This person knows what's happening. It's gonna be all right. So just, of course, we have to do all our therapy stuff, but just always have that as your overreaching thing in all of your interactions with your patients. Another big comment to make is every patient is grieving. They are dealing with and managing and figuring out all the losses from whatever has happened to them. So a loss of function, their activity, maybe a loss of income, their whole, maybe it might be their place within their family structure, all kinds of things. They're socioeconomic and cultural and all kinds of things happening. There's this huge, massive picture, and they are grieving a loss, no matter what that is. I'm used to treating patients that are never going to be the same again. So strokes, head injuries, spinal cord, they're not going to be that same person that they were. So there's a huge amount of loss there. Might be the same for a guy with his golf swing and his tennis elbow. You know, it's all relative, right? Okay, I'll give one last comment. All I'm going to say is that I'm challenging you as you go forth in your career to acknowledge that your patient's experience is more than physical. It's greater experience than that. And just set your intention at the beginning of your session for healing. That's kind of my last comment. So thank you. Thank you all for listening. I'm sorry I spoke longer. It took me longer to get through it than I thought. So
to have a bit of extra time and want to have some discussion, we can stay for a while. If you have to leave, I understand that too. I know on our schedule this was our time, but it would be lovely to have any questions or discussion that anyone would like to have. Thank you so much, Nicole.
thank you.
It was a powerful story, and it's really great to have you here. So I'll just be quiet and see. Oh, Taylor has put into the chat. First, thank you so much for being vulnerable by sharing your story with us. I really appreciate it. You've mentioned how much uncertainty and fear you experienced throughout your diagnosis and treatment. You also mentioned how you were very aware of everything that everyone told you, as well as their body language. Do you have any advice for a bunch of nervous physio students before walking into a placement where we will be coming alongside patients who are experiencing fear and uncertainty, and how we can ensure our nervousness does not carry over to add to the patient's fear or uncertainty? Good question.
That's a fantastic question. Well, you're gonna feel like deer in the headlights on the first day of every placement, no matter what, and that's expected. But to honestly, just being yourself and being, trying not to be more or different than you are is probably your best bet. And if, most supervisors will be reasonable and helpful in that regard. But yeah, I don't know. I think the first few placements, it is super scary and whatever. And then you just kind of get a comfort level as the placement goes on and it just comes. I don't know. I don't know if I have great advice on that, but, half the time just admitting that you're nervous is probably the best bet. And then it kind of okay, now we can just get into it. It's okay.
Well, and I think even your talk here today will help all of us to think about how, okay, I'm feeling nervous, so I need to be extra aware of my body language, or I need to admit to the patient I'm feeling nervous and it's my first day. Just even the consciousness of your story, I think, is helpful.
Sorry I went on so long. I thought I'd be done by 4, everybody.
Nicole,
okay.
if I may, I have a question. If no other students have a question, it'll just take a moment. There's quite a bit of information right now about calling somebody a hero, which I think might be a mistake. So I understand it's trying to be an encouraging thing to say. So if somebody said that to you, so, oh, wow, you're doing so great, or at least this didn't happen, or at least that didn't happen. Like, how do those kind of comments come across to you as a patient?
You know what? They don't usually come across that well. And just even like that group of dancers, we talk about that quite often. And the whole pink campaign is really kind of tough because things aren't always said in the best manner, and it kind of puts pressure on. I'm not a hero because I got cancer. Like, this really crappy thing happened, and I'm just getting through it like anybody else. And then you know, I'm not doing it when you're on the receiving end of it. It's like I don't feel like I'm doing anything special. You just sort of and I think that's a really common theme. Like a lot of women say that doesn't feel, they don't want to have that extra, feels kind of like a pressure thing. Oh, I guess I have to act a certain way because that's how people see me or portray me, or if that makes sense. So I think like anything else, you just meet somebody where they're at and just be honest and not. And I think acknowledging it usually is better than not. It's more awkward when you don't. You know, it's like,
Oh,
hey,
that's good advice. Thank you.
yeah, like I found that a lot where you'd meet them on the street and then it'd be this total, oh my God, what do I say? And it's like, just you know what, I heard this happened. This is what's going on for you, or you've been going through this. And I think honesty is the best policy most times. But yeah, that's a good question too.
All right. Well, I think I'll call for a round of virtual applause here. And
Thanks, you guys.
thank you so much for being with us and sharing your story. And
come to Regina for placements, you guys.
and for tomorrow, we're back together at 12:30. And if you could come prepared with sort of those guest speaker topic worksheets to be prepared for some discussion tomorrow. We'll see you tomorrow at 12:30. We'll start as a large group on Zoom together. So have a good evening and a good morning tomorrow, everybody. And we'll see you tomorrow. Okay.
Take care, everyone.